they tell you, we got to do a procedure or we got to do something, and then they just kind of leave you sitting in a room without knowing what's going on the other side of those doors, and I believe that's the hardest part.
Quincy Jones spent months on a roller coaster ride watching his 4-year-old son deal with the lingering impact of COVID, including a severe case of Miss C. Now, we have been following his and other children's recovery throughout this pandemic, and it is of growing concern, with doctors now saying up to 50% of children may experience long-term symptoms of COVID. Caitlin Ross has this troubling story for us new tonight.
The lingering impact on kids can be serious and affect their ability to succeed at school. Doctors across the metro are warning parents tonight they need to do everything they can to make sure their kids don't get sick.
We have 240% increase in our children being infected.
Dr. Jane Morgan with Piedmont Healthcare says they've been seeing an alarming rise in kids reporting long-term effects of COVID, and parents need to do everything they can to protect them from getting sick.
The sad part of it is that children may not be affected by and large early on, but they may have long-term symptoms that they are dealing with. And at this point, we don't know how long those last.
She says long-term effects include brain fog, fatigue, and exercise intolerance, where they're too weak to get out there and play at recess or play sports like they want to. Children's Healthcare of Atlanta says they've seen a similar trend in the kids they treat. Right now, there are 49 pediatric patients with COVID. That's almost 9% of all the kids at the hospital.
The Delta variant definitely has impacted children in a much stronger way than the first waves did.
Children's Healthcare of Atlanta hosted a Facebook Live today to educate parents about how the virus is changing and your best course to protect your kids.
Wear your mask, to wash your hands, and to watch your distance.
The message coming from both healthcare professionals: adults can protect children by getting vaccinated and creating a bubble around them, and then getting their kids vaccinated as soon as they're eligible.